My name is Fabrizio Billi, and I'm a scientist in the Department of Orthopedic Surgery. I specialize in musculoskeletal research and medical innovation. For the past several years, I focus on developing cutting-edge technology that enhance patient care and solve some of the most pressing clinical challenges. My work has been recognized with several awards, including the John Charlie Award, the most prestigious honor in orthopedics. Several of our technologies have been licensed by commercial partners. Each year, more than 1.9 million knee and hip replacement and 6 million orthopedic trauma procedures are performed in the United States. One of the most serious complications following this surgery is infection. Once an implant gets infected, a series of complications arise that can lead to delayed healing, prolonged anti-infective treatments, multiple surgeries, and in severe cases, when the infection cannot be controlled, even amputation. These infections are difficult to treat because of the formation on the metal implant surface of a biofilm, which acts as a shield that protects and makes bacteria resistant to both the immune system and the antibiotics. We developed a novel solution called EMPACT, Electromagnetic-Activated Nanoparticle Therapy. This technology uses a combination of functionalized magnetic nanoparticles and electromagnetic fields. The nanoparticles are designed to attach to the bacterial membrane and the extracellular polymeric substance that forms the biofilm. The electromagnetic field and the nanoparticle then work synergistically through mechanical and electrical interference. This leads to weakening, destruction of the biofilm, direct bacterial death by disrupting the cell membrane, and to augment antibiotic efficacy. The nanoparticles could be delivered in various ways. For example, via a spray or a gel dressing or local injection. In our in vitro studies, we've seen a dramatic increase in biofilm eradication and bacterial disruption, even without antibiotics. What's more, we have envisioned the electromagnetic system being wearable, packaged into a device about the size of a computer mouse, making it convenient for patient use. The nanoparticles could be delivered in various ways, including via spray, a gel dressing, or a local injection. EMPACT can work either as a standalone treatment or in conjunction with standard surgical procedure for infections. Importantly, and regardless of either application, financial models have shown EMPACT to be cost beneficial. We are advancing this work through more preclinical testing with the goal of moving into in vivo studies. While our focus is on orthopedic infections, EMPACT has a broader potential application. We can modify these nanoparticles, and the technology could be adapted for other medical device-related infections, for example, cardiovascular implant, or even cancer treatments where precise target is crucial. At this stage, we are seeking $4 million in funding to complete our preclinical work and initiate clinical trials. We are also looking for partnership with medical device companies, healthcare providers, and investors to help bring these groundbreaking technologies to market. Together, we can transform how infections are treated. I look forward to discussing how we can collaborate to take this technology to the next level. Thank you.